So I would like to address just for a second that issue of how do we protect the healthcare workers, because I never hear anybody say this answer. You know how you protect healthcare workers? People are always like, we should thank them. Absolutely, you should. You want to thank them? You want to protect them? Be healthier. Take some personal responsibility and you be healthier. Who winds up in the ER? Unhealthy people, especially with COVID. Now, sometimes they can't help that, of course. You can't always help that. But mostly it's from lifestyle choices. You could be healthier, and that is how you could protect healthcare workers. As long as we're talking about this, I want to ask about Kyrie Irving, because, like, I'm a basketball fan, the playoffs are starting. And to me, this is exactly why people are fed up with this. I saw a poll recently. 70% of people say, COVID, we're just going to have to live with it. Let's get on with our lives. Did you see that? 70%? Okay, that's where America seems to be. Kyrie Irving is a great basketball player. He can not play in New York in home games because that is their law. He can play on the road, and he does. The other day, they saw him sitting in the stands, one row behind, but he couldn't step on the court. There he was, maskless with all the other maskless people, sitting in the stands, but if he stepped on the court, he would somehow be a threat to humanity.
And I believe that if he had been, say, a player for the Orlando Magic,
yes,
he would have been allowed to play in New York as a visiting player.
I should have said he's unvaccinated. That's why he can't play, and he will not get vaccinated. Okay, that's his choice. It should be respected more than it is, but okay.
Why should we respect that? Should he go in with a loaded gun and spin it around? He could hurt somebody.
You know what? I'm sorry, Max, but that's arrogant about health in general. Why? Because you're assuming that we know everything about health, and we don't.
But we know the vaccines work. We know they're safe.
We know the vaccines work. We know antibiotics.
I did it.
Yes.
Did you do it?
I did. We did it.
We all did it.
Okay. First of all, there are a couple of types of different. I did it. I didn't want to do it.
We all did it.
I didn't want to do it.
I didn't want to do it. I was scared to death. But I'm more scared to death of infecting someone that I love and passing it along.
But that's you.
But we all have to live together. We all have to live in a country.
The problem is that's how the vaccines were originally sold, right? As this we protection, it's going to be something that you do for your community. And the problem was that the Delta and Omicron variants changed that. The science of it, suddenly the CDC comes out July of last year and goes, well, the vaccines are good at protecting you from severe illness, but they're less good at protecting you from transmission.
But it assumes we're all more afraid of COVID than anything else. I'm more afraid of cancer. Now, am I saying the vaccine causes cancer? Of course not. What I'm saying is we don't know a lot about health. We don't know what causes cancer. We don't know what confluence of different things. I'm not saying it's the vaccine. I'm saying until we answer basic questions about health, don't tell me how to handle my health. There are a couple of different types of people who don't want the vaccine. There are idiots who think it has a microchip in it. And then there are people like Kyrie Irving and Aaron Rodgers and Djokovic who are finely tuned athletes who are very careful about everything they put in their body. And they want to handle their health with their natural system. That should be respected.
Well, you're afraid of cancer. But you're afraid of cancer, but cancer is not contagious. No, you should be able to do what you want with your body. But if your body affects someone else's, you should be able to do what you want with your body. But if your body affects someone else's,
so I should, wow, that's a lot of asking of me. I mean, you're right. I will go to certain steps to help other people. But, but if you're asking me, I mean, remember when Obama was saying, if you like your doctor, you can keep your doctor, and everyone was very upset when that didn't apply to like 2% of the people. But what was the point of that? The point of that was you get to listen to your doctor's advice. What if my doctor's advice is different than what your doctor's advice is? Wasn't that the whole point of I get to keep and listen to my doctor?
The vaccines are great at protecting you from severe illness.
Correct.
And so I think the problem is that a lot of the messaging through all of last summer was about this collective action problem. And now we've seen over the last couple of months, we went through the Omicron phase. A lot of people who were vaccinated said, I was vaccinated, I was boosted, I wore masks, I still got this stupid virus.
Well,
I'm done.
again,
and so now it can't be the collective messaging. We're all in this together. Those people have already gotten the vaccine.
Because they were
It's
wrong.
got to be about what's my
And
own
that's the
personal
point.
risk
They were
calculation.
wrong about that. And I don't blame them for being wrong about it. They said, Joe Biden said only 6 months ago, if you have this vaccine, you're not going to get the disease. Not true. Again, I'm not blaming you. I don't think it's because of corruption. I'm just saying you don't know a lot about how the body works. We know more than we used to. We don't know enough to assure me that you could just tell me because you're wearing the white coat, do what I say.
But here's
just do what I say and trust me, because when have we ever been wrong? And my answer is you've been wrong a lot. Not your fault.
Well,
it's
but
just where we are.
Here's something they were not wrong about. Is that getting a vaccine doesn't just save you from dying, it keeps you out of the hospital. Have you ever heard of something called a code black? Anyone ever heard of this? Do you know what a code black is? Code black means there are no hospital beds left, not just in the hospital, in the entire city. So if you don't get vaccinated and you get COVID bad enough that you have to go to the hospital, you may survive, but you are taking that hospital bed away from someone else who may need it for some other reason.
The reason why hospitals get overrun is because we run them like airlines. Just the way an airline can never have an empty seat, the hospitals don't want empty beds. So they're always at almost capacity. We're not there now. We're not there now.
No, now we're in a good place so we can enjoy our lives.
But I don't see people enjoy. I was driving around LA finally because we can come into the office now. Driving on the way to the office the other day, and I saw so many always young people with masks outside. Outside. These are the people follow the science. Well, that's not the science. We were never going to get it outside.
There's a very big difference in risk perception, and it correlates very strongly with political ideology, that even for people who just think of themselves as liberal,
Yes.
not very liberal, but just liberal, they're actually no more likely than folks who are pretty conservative to say they are very freaked out by COVID. It is just the very liberal slice where about half of them still say, I am gravely concerned about the threat of COVID. And so they're kind of in some ways out there on their own on this. But even for Americans who fall in that other, I'm a little worried about it, but not too much. The way most people look at COVID is everybody who's more cautious than me is a lunatic who is overly cautious, and everyone who is less cautious than me is reckless. And that's the way most Americans, regardless of what their actual risk perception is, feel about this.
Right. But the people with the masks, it's based on bad information. I've seen the polling on this. Like an astounding number of Democrats thought that the number of people who got COVID who had to go to the hospital was over 50% when it was under 1. That's bad information. How did that happen?
Again, it's people overestimate the extent to which all sorts of negative things will potentially happen to them. We just as a species are really bad at risk perception. And I think it's one thing to say, look, even if there's a very low risk of a really bad outcome happening to me, I want to do things like maybe I'll wear a mask to try to avoid that really bad outcome.
Is the Queen still alive?
She is.
Okay. Didn't she get it?
And she was vaccinated and boosted.
And she's 150.
And she's trucking, man. She's going.
Okay. So, all right. I saw this in the paper today, and I have to ask you both about this. 84% of people think it is a serious problem that people can't speak freely without fear of retaliation. I've never seen that. I've seen that number way over 50%. I've never seen it that high. Even the New York Times editorial board. Wow, that's a lot, because I would formerly have put them in the part of the problem category. Even they said, however you define cancel culture, Americans know it exists and feel its burden. What do you think about that?
That was a pretty big change for them, or at least it was surprising.
Shocking.
One of the things they're getting some pushback on, and I'm sympathetic to this pushback, is that their definition of freedom of speech in this article is that you should be able to say what you want without fear of blowback. And I don't think that that's the case. I think think that you should be able to say what you want, and that sometimes there are consequences for the things you say. Those consequences can mean you get criticized by other people. Other people still have the right to exercise their freedom of speech to say you're wrong. So this comes to the question of, well, when does my right to free speech infringe on yours? They run into your right to criticize me back. I do think that that's where the New York Times folks got this a little bit wrong. But generally, I was glad to see them come out and take this sort of a stance, because it was surprising to me.
And we have to have this. This is the agreement we make to have a free and open society. Feelings will be hurt, egos will be bruised, there will be differences of opinion. I mean, look at us. I'm married with a kid, I don't smoke weed, and I read comic books. My life is your worst nightmare. And we're here. We're here.
You're right. And mine is your biggest dream. Anyway, we got to go to New Orleans.